All right, so today's lecture we're going to be focusing on this idea of mutually protected occlusion. Or another way to put it is to think about how our teeth should ideally contact each other, both in a static, kind of up and down as you close, and also a dynamic movement. So think about when you protrude your jaw straight forward or from side to side. So as we look at our masticatory system, we see that it can be broken up into different components. So we have our joints, we have our teeth, and we have our muscles, and also the neuromusculature that coordinates and controls those three components. So we can see that they all function in a coordinated manner, and the system is made up of the bones, joints, ligaments, teeth, and muscles. So we can see that our teeth here are connected to the jawbone via a PDL. And as we explore this idea of mutually protected occlusion, the question that we're trying to answer is, well, what's the ideal way in which our teeth should come together? So let's take a look at the definition according to the glossary of prosthodontic terms. So mutually protected occlusion is an occlusal scheme in which the posterior teeth prevent excessive contact on the anterior teeth in maximum intercuspation. So remember, maximum intercuspation just describes the position in which all your teeth are maximally interdigitated with each other. So think of that endpoint position if you were to close together and squeeze all your teeth together. Okay, so all the teeth are maximally intercuspated to each other. And the second part of the definition is the anterior teeth disengaging the posterior teeth in all mandibular excursive movements. Okay, so an easy way to think about this is mutually protected occlusion, right? So mutually meaning two categories. So the two categories we're going to break this up into is posterior teeth and anterior teeth. So an easy way to rephrase that definition is just an occlusal scheme where posterior teeth protect anterior teeth and vice versa when anterior teeth protect posterior teeth. So how do the posterior teeth protect anterior teeth? The definition once again is that it prevents excessive contact on the anterior teeth in MIP. So maybe a better way to phrase this question, or another way to think about it, is to ask this question: well, how are the posterior teeth designed to protect the anterior teeth? So how does the form of the teeth sort of influence its function? Okay, so we're going to explore sort of three things that posterior teeth are designed so that they function to protect the anterior teeth. And the first thing we're going to take a look is just the number of roots. So if you go back to your dental anatomy class, and I'll put up a picture here, you can clearly see that there's a difference between the number of roots between anterior and posterior teeth. So let's just take the first molar for example. A maxillary first molar has 3 roots to it, where anterior teeth only have 1. So just based on the number of roots and also how the roots are positioned, you can see that the posterior teeth provide a much more stable base to absorb these vertical forces. So think about a tripod versus like a nail. If you were to drive force vertically down into a tripod, you can see that the way that the roots or the pods or the legs are spread out, they can absorb that force a lot more easy than if it's just concentrated on one root. Okay, so along with the number of roots, you have this idea of periodontal ligament. So the PDL, and it acts as a natural shock absorber to be able to absorb all these forces. So you think about, if you have greater number of roots, you have a greater surface area. A greater surface area means that obviously you have more ligaments attached to the tooth that connects it to the bone. So as you're constantly receiving these occlusal forces, the PDL acts to absorb and distribute these forces in order to minimize the destructive force that applies to the tooth and the ligament and the bone. So the whole idea of this protected occlusion is that we want to obviously maintain the health of our teeth and the whole complex by reducing the amount of force and not exceeding its absorptive capacity. Okay. So number of roots, that's one factor in which the posterior teeth are designed to protect the anterior teeth, or how it's differentiated. Okay. Another thing we can look at is if we look at the occlusal table of posterior teeth compared to the anterior teeth. So we can see in our posterior teeth we have a wide occlusal table that serves sort of as a platform in which the opposing tooth can contact and then thus drive the force or orient the force along the long axis of the tooth. And if you were to look at a anterior teeth, we have an incisal edge, and we don't have a big wide occlusal table. Okay, so what we're trying to get after is this idea of axial loading. So as teeth contact each other, ideally we have the teeth directed along the long axis of the tooth. So the development of these tooth contacts on a nice broad table allows for the transmission of force down into the roots, into the PDL, and for that force to be absorbed. Okay, so again, you can see the difference in the design of a posterior tooth compared to an anterior, which sets it up to be able to absorb these forces in a vertical direction. Okay, and in a very similar principle, so this occlusal table is very much so connected to this idea of the orientation of the teeth, or the opposing teeth. So as we pull up this picture, it's plain and obvious to see that the posterior teeth are oriented pretty much in a straight line with each other. So this vertical orientation against each other allows the force again to be driven down through the root structure in an ideal way for the force to be distributed. And if you were to contrast that to the anterior teeth, you can see the anterior teeth are positioned at a bit of an angle. So again, if you go back to this hammer and nail analogy, you can see that as you hammer and drive a nail straight down, that's going to concentrate the force sort of at its tip, and it's going to go straight. Whereas if you were to constantly hit a nail off axis or an angle, well, what's going to happen to that nail? It's going to bend. Okay, so as we'll see in a later example, as we talk about occlusal trauma, if you overload these anterior teeth and you exceed its absorptive capacity, you're going to see that these teeth tend to migrate and move out of the way because their loading is off axis, and you're bending the tooth or moving the tooth out of its natural axis of orientation. Okay. So vertical loading eliminates the off-axis forces, and it thereby effectively allows the PDL to accept the potentially damaging forces to the bone and essentially reduces them. Okay, so the whole idea again is this idea of mutually protected occlusion is that we're trying to protect the teeth and keep it in this harmonious relationship. Okay. All right, so just as a summary, how do the posterior teeth protect anterior teeth? We're going to point to three different aspects: the number of roots, the wide occlusal table, and the orientation of teeth. All those things set the posterior teeth up to be able to take on force in a vertical direction and protect the anterior teeth from overloading, because we know the anterior teeth don't do as well in absorbing these vertical loads. Okay, so let's reverse this question, and we're going to dive into this idea of how do the anterior teeth protect the posterior teeth. And again, we're going to point out three different things, but let me first read this part of the definition. So anterior teeth disengage the posterior teeth in all mandibular excursive movements. Okay, so we'll answer the same question. Well, how are the anterior teeth designed to protect posterior teeth? One of the things we're going to look at is the length of this root. So let's just focus in on the canine for now. So the canine is our longest rooted tooth in the mouth. So it has a favorable crown to root ratio. Okay, so if we think about taking on forces in a lateral direction, so now we're looking at teeth as they contact each other, not in a straight up and down like you're biting, but now as they grind either side to side or forward. we can see that the posterior teeth actually don't tolerate lateral forces very well. So when a tooth is contacted on an incline, the resultant force is not directed through the long axis. Instead, it has a horizontal component, and that tends to cause tipping motions. So therefore, when horizontally directed forces are applied to the tooth, many of the fibers of the PDL are not properly aligned to control them. As the tooth tips, some areas of the PDL are compressed while others are pulled or elongated. Overall, the forces are not effectively dissipated to the bone. Right, so this slide just kind of highlights a point that in lateral forces, posterior teeth don't do very well. They're not designed to take on those tipping forces. However, as you look at the anterior teeth, because of the length of the canine, we're going to say that the canine has the ability to take on these tipping forces. Okay, so the long crown to root ratio and just the sheer length of the root makes this the ideal tooth to take on any sort of lateral or side-to-side loading. Okay, so we're going to visit this idea of canine guidance, which just means that the canine serves to separate the posterior teeth in these lateral excursive movements. All right, so let's move on to a second point. So how does moving the contact point anteriorly affect the force applied to the tooth? So if you're going to think about this idea of a nut cracker, right? If you want to crack a nut, where do you want to position the nut? Closest to the hinge or further away? Well, to maximize the force, you're going to put it as close to the hinge as you can. So when we look at this idea of force and try to minimize force, if we can move the contact point of teeth away from the hinge axis or where our condyles are located, then the less force that is going to be applied to our teeth. So you can see in this diagram how the anterior teeth are positioned further away from the hinge. Okay, so we're trying to move the contact point anteriorly. So if we take a look at these two different concepts of group function and canine guidance, you'll see that in group function, what we have is when you slide your teeth from side to side, you have multiple posterior teeth coming in contact with each other. Okay, so if we look at that principle of contact in relation to the hinge, we would say that the forces generated on the posterior teeth or in group function is going to be much greater because these teeth are closer to the hinge axis. Whereas if you contrast that with canine guidance, and if we can solely have the discluding teeth on the longest rooted tooth in our mouth, the canine, then that will result in minimizing force or decrease of force, because this canine is the only one that's touching and it's much further away from the hinge. So again, similar to that nutcracker example, when you move the nut further away from the hinge, the less force that's applied. So the less force that's applied, then the greater the protective factor of our teeth. All right, so let me just have a point of clarification. So we're going to say that canine guidance is more ideal of an occlusal scheme when we're talking about lateral excursives than group function. It doesn't necessarily mean that group function is going to lead to some sort of pathology or signs and symptoms of occlusal trauma. So group function can be a very acceptable occlusal scheme provided that it doesn't result in any signs and symptoms of trauma. And we're going to visit that shortly. All right, so another principle that I want to point out is the fact that as you move contact of the teeth away from the hinge axis or onto your anterior teeth, you're actually going to find that your muscle activity decreases. So an easy way to think about this or test this is right now put all your teeth together and squeeze as hard as you can. Think about how much force you can generate on those teeth. Now slide your teeth so that your anterior teeth are edge to edge to each other. Okay, so as you're edge to edge, now squeeze your muscles together. Think about how much less force that your muscles contract. So the principle is, as you concentrate forces onto the anterior teeth, your muscles or your neuromusculature actually shuts down muscle activity. So you're not able to bite down and exert as much force when your anterior teeth are under load. Okay, so here, sort of in the text, you can see a comparison of the maximal biting forces when we compare anterior to posterior. Okay, so that's that last principle, is when we talk about muscle activity. Okay, so the advantage of having anterior teeth is that as you input and put force on it, you tend to deactivate some of the muscle activity. Okay, so it appears that fewer muscles are active when anterior teeth make contact during eccentric movements, and when posterior teeth are in contact. So this is just a slide just kind of summarizing these points. The canines provide disclusion in a lateral movement, and if we kind of study the teeth as they slide straight forward, so what we call a straight protrusive movement, it's actually your incisors that do most of this work. Okay, so I know that first point we're saying longest tooth, in a protrusive movement the incisors are doing the work, so obviously the idea of the longest rooted tooth doesn't apply to the incisors, but the last 2 points that we pointed out do apply. So the incisors obviously are further away from the hinge, and also that they decrease muscle activity when you concentrate force on them. So just a point of clarification, canines provide disclusion in a lateral movement, and then incisors do most of the heavy lifting when we talk about straight protrusive movement. So these are just two diagrams that kind of point out the difference in the motion. Okay, so straight protrusive, you can see that the anterior teeth, or the incisors, are the ones that disclude. Okay, so anterior teeth separate the posterior teeth in protrusion. So notice here, when the patient slides their jaw to the side, it's the canines that separate the posterior teeth. Now when the patient returns back and now slides in a straight protrusive movement, look at the incisors. They're the ones now that separate the back teeth. So that's the difference between a lateral or canine guidance and then a protrusive. Alright, so just a quick summary. Mutually protected occlusion. Posterior teeth protect anterior teeth because they have more roots. Occlusal table is wider, and the direction of force is oriented more ideally in a vertical direction. Whereas the anterior teeth protect the posterior teeth. We want to take a look at the longest root, especially the canine. In a lateral movement, the canine is able to withstand lateral forces and separate the back teeth. And then we're moving the contact points anteriorly, and we also know that we decrease muscle activity.